Hello everyone, welcome to this lecture Association and Causation. Association is a statistical relationship between the exposure and the outcome. Seen in observational studies, may be due to bias, it may be due to chance, it may be due to confounding, or due to true causal relationship. Type of association we have spurious association. It's not a real association. For example, high maternal mortality rate is noted in the hospital than home deliveries. That doesn't mean that home deliveries are safe, because so many severe cases are reported to hospital. That is why maternal mortality rate is high in hospitals. Now, indirect association, there may be another factor between the exposure and an outcome. For example, increased altitude may develop goiter. The other factor involved in goiter is iodine deficiency. Now, in direct association, also called causal association, there are two types: one-to-one causal relationship and multifactorial causation. One-to-one, one exposure will be causing a disease or multiple diseases. Change in the severity of A or extent of involvement, duration of exposure to A can cause severity in outcome B. For example, Treponema pallidum can cause syphilis. Hemolytic streptococci can cause multiple outcome. Rheumatic heart disease, it can cause tonsillitis, it can cause scarlet fever, it can cause erysipelas. Multifactorial causation and web of causation. Factors independently can cause disease or cumulatively can cause disease. For example, smoking can cause lung cancer, and air pollution also can cause lung cancer. Asbestos exposure also can cause lung cancer. Cumulatively, hypertension, smoking, and increased cholesterol may lead to cardiovascular disease. In one-to-one causal association, there is specific agent. Here in multifactorial causation, no specific agent, there are multiple exposures are there. Now, causation. Causation is an event or condition or characteristic which plays an important role in the occurrence of an outcome or disease. Observational studies, we can get association, but causal relationship we only get from the RCTs. So the criteria to tell there is causal relationship, Bradford Hill criteria is there. First is T for temporality. Cause must precede the disease. So first there should be an exposure, then only outcome. And strength of association, relative risk odds ratio, there should be an adequate finding suggesting an association between the exposure and then outcome. Biological gradient, it's a dose response relationship. When we increase the exposure, long exposure or high intensity exposure may lead increased severity of the disease. Now, consistency, we should compare the results with other different studies which was done among different population and different time. It should match with the, it should also provide the same results. Now, coherence, our study should align with the known facts. For example, smoking and lung cancer. Known fact is that lung cancer is most common seen in smokers. Other factors that quitting smoking cause reduction in the incidence of the cancer. More squamous cell carcinoma is seen in the smokers. These are the known facts. Our study should align with the known fact. Now, plausibility. There should be a reasonable mechanism. For example, smoking causes lung cancer. Smoking release carcinogens that may damage the DNA, eventually metaplasia, dysplasia, and carcinoma. Now, specificity. Particular exposure is associated with particular disease. For example, smoking is associated with lung cancer. Alcohol drinking is associated with pancreatic cancer. But we can't tell that smoking only causes lung cancer. Smoking can cause oral cancer as well. So specificity is the least criteria. It is not always applicable. Now, experiment. There should be an experimental study results to prove that the results are correct. Analogy. There should be a supportive evidence, similar agent known to produce similar effect. For example, smoking causes lung cancer. Supportive evidence we have that nowadays lung cancer is more seen in females. Smoking rate in females also increasing. According to this Bradford health criteria, if that study fits almost every criteria of this, we can tell that causality proved. Most of the RCTs proves causality. So we are at end of our lecture. Thank you for listening.